All right, we have another P ray here, and this woman looks like she's got a sway back. What do you see,
Right.
Rain?
With an anterior tilt.
Yeah,
Got double trouble.
and she has reported some spine issues and some heart palpitation.
And she has a rotation, and or what we can really look at is her right hip is much higher than her
Yeah,
left from the back. So that's causing a distortion of sorts.
yeah, you can see it right in the pants.
Yeah, it makes it so easy.
Yep.
It's very helpful. And then what you're going to look at is her femurs, right? Because the femurs tell us, the knees tell us things. So when we go to this picture, there's just not as much activity as we need in the primary hip flexors,
Yeah.
especially on lefty. Lefties really needs more tone. But it's the alignment that we're worried about. And that's why we can also look at the hip flexors. So a lot of people are always like, oh no, I need to stretch my hip flexors. In a body type like this, we need to balance the hip flexors and specifically the psoas and
Yeah.
the iliopsoas.
Look,
PSOAS.
these feet are really averted too.
Because the primary hip flexors aren't doing their jobs, the pelvis isn't holding itself stable. So you make a wider base and
Yeah.
an external rotation. So she's leaning in to gripping in the deep muscles in her butt, but she doesn't have proper stabilization, right? That's why it's kind of crooked. One's higher than the other,
Yeah.
and it's not strong. It's just gripping deep inside the deep lateral rotators.
And
All
I
six.
and I see some cervical flexion here, and she's kind of
Right.
forward.
But it, fallen forward.
Yeah.
Yeah, because if you look at the body like a building, right? The hips are definitely your foundation. So her foundation is off.
Yeah.
And then it's rotated a bit. So not if anything is rotated, it's going to affect above. So we go above her and we see a disjointed thoracic moving to the left to kind of balance the hip going right.
Mm-hmm.
And then that throws the shoulders off, and then the left leg doesn't work to stabilize at all. So we would immediately want to increase the activity of her psoas or rehabilitate them. Instead of just thinking we need to stretch them, we're going to stretch some muscles for sure. But
Yeah.
we also want to get her pelvis stronger so that when she bends forward, she doesn't rotate and
Right.
she can rebalance that. And that's why I think it's so good to see the origin to insertion and how that's affecting her back. Right?
Yeah.
A lot
This.
of people don't get it.
Yeah. The psoas goes from the lumbar to the femur. So this is, like a bridge connecting ourselves here.
It is, and it also switches its origin and insertion depending upon use. Right, so you can see it goes all the way up to your T12, and it starts at the lesser trochanter or vice versa, depending upon what we need.
Hmm.
So in this video, the pelvis is stabilized and the leg is being externally rotated and abducted.
Right.
Right, so that's something the psoas does. But it's also, when you do a sit-up, there's that end part of the sit-up where you use your psoas to get up. Sometimes people think it's cheating when they like, oh no, I shouldn't be using my hip flexors. Well, you have to use your hip flexors to finish that sit-up. So sometimes again, yep, and it's also a stabilizer. That's a good one.
Here's your setup.
Yeah.
Yeah.
Right. So that person right there is not using their hip flexors as much. They're using more abs. That'd be like your hundreds or your Pilates or a deep, deep contraction.
Yeah.
There's another one. If you choose, scroll down and it will go up.
No.
Other way. Go pick that one. Fixed thigh. Second one. Flexing the trunk on the femur. Yep.
Yeah.
This is your sit-up that a lot of us sometimes don't practice, but we should. And this is because this is a postural sort of sit-up. From it makes you have to use your hip flexors. So we could ask this individual to work on something like this. We're probably going to do it for her on the floor because we want to reduce her rotation,
Yeah.
but she needs to rebuild that strength to then move her pelvis back over her legs to straighten up her legs. Right now she's sitting in her psoas, and that's creating that external rotation down in her feet and that kind of swinging forward, but she's tight on one side, hence
Yeah.
the lift. So activities like this, one side is more active than the other, and then we have an imbalance.
Yeah. And this is always fascinating to me that, the femur, it gets rotate, it can get rotated out like this
Mhm.
just from this amazingly strong muscle.
Definitely. It's one of the movers. There's other synergistics, but what's critical about the psoas is, and its companion, the iliacus, it's a hip flexor, back stabilizer. It works with breathing because of its location on T12 and the diaphragm. So having a tight low back or a psoas that doesn't open and close with length and strength, the diaphragm can't descend, the back can't open. So there's a lot of breathing. And if breathing's being messed with, your heart's being messed with, then that's going to engage the way your rib cage sits. So,
Right.
and then many people associate the psoas with emotions, anxiety,
Yes.
all these things. So a little visit to the tower might be good for her too, eventually.
Yeah. She'll start
Give
crying in
her
the
a lot of
tower.
peace.
People start crying in the tower.
But it would undo the tight side and let the other side start working. Because that's what we're trying to do. We're looking for balance. We're not trying to fix a problem. We're creating balance in the system for a holistic healing, inside out, outside in.
Now look how far ahead of the line she is. Her
Right.
hips, her shoulders, her ears are way out in front.
So where your blue dot is, underneath that, you've got lateral rotators, deep muscles, the bottom of the glute is firing. So she's gripping in these tiny muscles, and they're supposed to work with that psoas. They're like the rotator cuff, but they're the lateral rotators of the hip. Now she's gripping in them and her pelvis moves forward. So right where your blue dot is, there's a tremendous amount of force happening. And on the other side, right, it's same different, but that's hip is hiked on the right side. So we're going to get even another imagery. But it's basically her calves and her deep lateral rotators that are holding her on the earth and taking that wider stance. Because you can see she's literally falling forward.
Yeah, she's falling
like
forward.
her brain knows she's falling forward. So something's going to grip. I mean, gravity will win every time.
So her calves are strong.
Her calves, her feet, we don't know where it's playing out. I think it's her right hip is really strong in the sense of it's lifted. I don't think it's strong functional. I think it's more active with the psoas, and I feel like the left side needs to get more activity. So she could balance that out. Then we get her legs going straight, but we can't, force the leg to fit the pelvis until we ask the pelvis to balance. And then we need to take out the rotation, which is kind of the same thing when it comes to the pelvis, because the minute you start working on the up down or the forward back, we're creating a whole body shift because it's such a big piece of us, right? We've got the head, and the head energy comes through that pelvis and down the legs. So if we've got clients who are slightly twisted, that energy doesn't follow those lines, doesn't hit the ground, doesn't utilize centrifugal force, and then it goes back out. I mean, watch tennis right now. You want to see primo athletes using gravity and centrifugal force, go watch people chase tennis balls. Like, that's an insane sport at a professional level because they have to react, they have to move, they have to pause, they have to react, and they have to keep resetting. And meanwhile, there's this thing that's flying around that's being affected by gravity. And I know we joke about that, but gravity is pulling us down. I mean, it really is. So if you've got a client leaning forward, you better believe her calves are so tight, not functional, but tight.
And look, you can see the anterior pelvic tilt here, just diagonal falling down. You see a little bit of the kind of the belly falling over very slightly.
I would call that the rotation.
Yeah.
honestly. The belly falling over, I would call rotation, because the oblique system, which is your side slings and front slings, when it gets pulled, people feel more fat. Like the love handles are often obliques that aren't working well. People are always like, oh my gosh, I started doing my posture exercises and my inches are changing. Yes, because the waistline is not a joint. You don't bend forward and back from it. We need to get a culture to use our hips again. Hip hinging, hip hinging.
Yeah, we can lose our saddlebags from postural therapy.
Yeah, absolutely. I mean, they're just floppy skin.
Look at this.
And that's going to affect everything. There's no way her shoulders can come down her back until she brings what we call back back.
Look at this. Look at her shoulders are, I don't even know how to describe it. They're like,
They're elevated and forward.
yes. Yes.
They're elevated and forward.
Like this, where my mouse is here, almost should be here, like going like
and
this.
down.
Yeah.
Mhm. But if you think of your shoulder blades, particularly with this client, like a backpack, right? We're going to balance her psoas muscle, which will undo the twist. Then the shoulders will be able to fall on her back, on her rib cage, because the rib cage is the second floor. The second floor will now be balanced because the first floor, which is foundation, will be
Right.
balanced.
Right.
We
I
could
like that.
attack it
First
from
floor,
the head.
second floor. I like that.
Yeah. I think people get that. I mean, they really can feel that. That's why posture works. You find the symptoms, you get rid of those, you look for the major dysfunction. But in this individual, her posture shows us she's weaker. Sometimes it's easier to actually see it. Like the wrestlers we've looked at when we brought up a wrestler,
Yeah.
right? They're built so they can overcompensate. We can strip this individual down and you can really see her pec minor is working hard. Her levators are working hard, her upper trap. So basically the girdle up here is suspending her shoulders up for her.
Yeah.
Because she doesn't have shoulder stabilizers on her rib cage, because she's rotated, because we know there's an imbalance in the psoas, which we've already established goes from the bottom of the T-spine to the leg. Hello, that's really big. It goes through 3 joints. So we attack the large thing and we can strengthen, right? A lot of people, again, I repeat myself, we're not interested in stretching people. We're interested in balancing you. She doesn't need any stretching. She needs to be rebalanced. Yeah, then look at the shoulders.
I noticed this too. Something
hip.
with the neck here.
Mm-hmm. Dysfunction.
Yeah, this could be
The
something.
neck
Yeah, that goes away.
Oh, it will, because now see the top of the left shoulder versus the right shoulder. If you're not utilizing your muscles correctly on your neck, they do nothing. This is a whole muscular system. And your neck is traditionally your shoulders. I think people forget the impact of this will do to this, right? It's just the same thing. Our body, when it's stretched out the best in its best posture, our skin hangs much better.
Yeah.
But the bones tell the skin where to go.
Yep.
And the left leg has a lot of tibia torsion in it. So we'd want to really rehabilitate that leg, because I'm sure the hamstrings are tight, like crazy tight. The calves are going to be tight. Pelvis dysfunctional.
Yeah.
It's all fixable. This is so great. I mean, there's nothing there that says otherwise. Like you look at the structure and you say, wow, that's not aligned. How do we fix that? And it's an algorithm, right? It's science and it's magic.
It is,
but it is an algorithm. You can watch your progress if you do the work.
That's right. And we're going to help her greatly, and working on a nutritional protocol as well for her. So looking forward to it.
Yay. I love what she's got coming. It's going to be fabulous for her. She's going to feel better.